A very good morning. We're glad you're still with us. For those that went with us into the break, I just have to do a reminder that the hashtag on Twitter is Morning at AT NTV, and the handle is at Chris Higenyi and at Priscilla Nali. We are going into a postscript, a ritual for Friday, where we have one of our very own journalists at Nation Media Group and NTV in particular come and help us understand some of the issues that they do cover on a daily, weekly, monthly, and sometimes on an annual basis. They bury themselves in the things, understand them, and of course should be able to give us some perspective. So this morning we are asking the prioritization of the neglected areas of sexual reproductive health rights in the media, reframing media coverage of SRHR among the youth. We are joined by indefatigable Olivia Komugisha. A very good morning.
Good morning.
How are you doing?
I'm great.
I love your afro.
Of course.
Is that an afro?
Yeah, this is my hair. Black girl magic comes with.
Black girl magic.
Of course.
Comes with what?
With an afro, of course. Yeah. That's what you get when you're a black girl.
Okay.
It's a nice kinky round hair.
Okay, let's talk about health and reproductive health when it comes to the education and the rights. First, define for us those terms.
Okay, so sexual and sexual health and reproductive health and rights, basically, which most people usually abbreviate as SRHR. It was coined in 1994 in Cairo at the ICPD conference. That's the International Conference on Population and Development in Cairo in 1994. But basically what it stands for, it's, I'm going to break it down in, for everyone to understand.
Yeah, sure.
It's
especially me.
It's a state of complete mental, physical, and social well-being. Yeah, but when you look at sexual reproductive health and rights, there are components in that word. There's sexual health, there's reproductive health, there's sexual rights, and reproductive rights. So this basically looks at the rights. When we talk about reproductive health, we look at the well-being of the body, yeah, and the reproductive system of a person. Then when we look at the reproductive rights, we are looking at the autonomy of someone, someone having the autonomy over their body, deciding when to give birth, how many children to have, the spacing, but that shouldn't take away the rights that they should get by me deciding to, not have children. It shouldn't be a crime, but it shouldn't also be a hurdle for me to access, contraception, to access reproductive health services. So I should be able to get all that. Then when you look at sexual rights, it basically stands that still the autonomy for someone to make decisions about their sexuality, sexual orientation, identification, all that, and that shouldn't also stop them from receiving the services they ought to receive because of their sexuality. That's who they identify as, and that people are supposed to receive the services regardless of their sexuality. So that's basically how I can term it.
Okay, so there's so many words that confuse me in this conversation. There's sexuality, there's sexism, then there's sensuality. What's the difference? There's sex itself. So what are the differences?
So I'll start with sex, because usually that's what gets people talking. Yeah, but
yeah, let's talk about sex.
Yeah, but sex is basically like the characteristics of being male or female, but also sex can also be used as the sexual activity, and I think that's what most of us are usually excited about. Then when you talk about sexuality, like I mentioned, it's basically the state of a complete state of mental, physical, and social well-being of someone. Yeah.
Okay. All right. So I know that a lot of this information ought to be backed by some bit of data. And so when we look at data, access to sexual and reproductive health and rights data in Uganda, do we have a database in the first place that covers all, you know? Because when we look at data or we hear the word data, it's usually in reference to maybe the urban centers, but I'm talking about both urban and rural.
Yeah, so this SRHR falls under two dockets. That's the Ministry of Health, because it's health related, but also part of Ministry of Gender Labor, because it has bits of young people and everything. But what I know, the UNFPA has a database, but we also have civil society organizations that are doing amazing work when it comes to sexual reproductive health and rights. Yeah, and they're always open, because I've done these stories, and every time I approach them, they're willing to share the data. Of course, sometimes most of the data they have may not be like constantly updated, but at least they have a vague figure of the data, and every time, as and when you need it, it's always available and accessible. I've done stories with UNFPA and the availed data. There's the Sexual Reproductive and Health Alliance, there's Reproductive Health Uganda. All those organizations are willing, and anytime, as and when you need them, they're able to share this information. But now that comes to, do we as journalists actually go out there to seek this information and data? And when we get it, how do we use it? How do we quantify it? How do we break it down for the viewers to actually understand how urgent it is for us to, you know, pay attention to SRHR? Yeah.
Lovely. I love the context of the ability of the media to break this information up so that the average Ugandan or the young man and woman out there can understand. And that brings me to the aspect of sex education and sexuality education. Many people, especially within the education sector, grapple with how they are going to roll this out. The schools think sexuality education should be with the parents. Parents think sex education should be with the schools, but it's overlapping. Now the media has a role to play here in reframing that conversation so that everyone is comfortable with it. How are we faring on that?
So first of all, I'll start with the fact that we are neglecting our roles and duties, first of all, as parents. Like when you say, like everyone is throwing the ball to the other person. Yeah. The parents are throwing the ball to the schools, and the schools are saying, I mean, these are your children.
Tossing it right back.
Yeah, and if for anything, the lockdown showed us that schools were, you know, faring well, because when these kids were sent back home, we saw what happened. We saw numbers of teenage pregnancies rising, skyrocketing, and everything. And these were really, really young people. So it's very important for us to have sexuality education and sex education, because some of these things that you're scared talking about, these kids know. They know.
They already know.
They already know.
Yeah.
They've probably, and most of the times is the information they have is not the right information. So the role of the media is, and I think we haven't reached there yet, but we're making progress. If we could prioritize sexual reproductive health and rights stories, because look, if there's a demonstration in Chiseka and I come with my feature on sexual reproductive health and rights, then definitely the
you
know, the demonstration will go fast. So I think it's a matter of prioritizing these stories and you know, putting out this correct information, because young people access media through all platforms, and media houses have all these platforms right now. They have all the social media platforms. So you know, packaging this information in the language that young people best understand, in the simplest of terms, and making it accessible for all these young people to, you know, survey all this information is definitely going to help and fill that gap. But that shouldn't take away the role of the parents in
this whole thing.
They shouldn't. Even the schools have a role to play, but also the parents must take charge and, you know, be the parents and play their role.
That's right.
Yeah.
What pressures are being exerted on social media in terms of this message being, you know, brought to the youngest of children to understand their sexuality and their reproductive health?
What pressures?
Yeah.
I think, first of all, to start with, young people, we all know that social media is like the happiest place to be. So they're definitely...
Really?
Yes.
Oh,
wow.
Chris, even you yourself.
Yes. I mean, you barely go, I mean, you can't go for 10 minutes without checking your phone.
Does that make it the happiest place to be? There's a context.
For
young people.
Not for you, Chris. For young
I'm
people.
also a young person, so I am speaking from a point of...
yeah.
Yeah.
Forgive me. The other day, some 2 young people called me Uncle Chris, and I was like, okay, now it's official.
Yeah, yeah.
Time
it's
is
okay.
going.
So us as young people, yeah, we're telling you. But yeah, it's at least it's the place where they get most of their information. And when you talk about the pressures, I feel like there shouldn't be any pressures. Some of these civil society organizations have tried to fill in that gap because they know where the young people are. They know the information they need. They know how the young people receive this information and how they want to receive it. So I don't think there are pressures. I don't think there are pressures.
Okay.
Let me just keep it there. Let me keep it on the issue of pressures and look at the social cultural setting and the challenges that many of the young women and men face when accessing, for example, information and the products that are related to sexual reproductive health rights. I've seen some of them being reluctant on account of how they are treated when they approach the sector holders when they want this information. As a 17-year-old seeking to buy a condom, and then the person who is dispensing it gives you this impression like, hey, you shouldn't even be buying that. Here is a young man who has this pressure acting on him, and he's trying to do the best he can do.
Okay.
How does that...
Now, I get that. First of all, to start with, it's true that when it comes to information, there's really a lot of scanty and wrong information, fake information out there. And I think it's very important, and that's where the media comes in and some of these CSOs to try and fill that gap and make, you know, first of all, debunk that fake news, but most importantly, avail this information. Like I said, some of these CSOs know where the young people are and where they consume information from.
That's right.
But like you talked about, you know, the access, first of all, access to information is hard, and it is even harder to access services, the right, correct information. And when it comes to services, it's even worse. You know, young people hold back because of that judgment. But one should be able to access these services without coercion, without judgment. But what's the reality on the ground? But what I've been seeing some of these CSOs do is they create safe spaces for young people where a fellow young person is the one who is going to serve you, and when they're serving you, they're not going to judge you. But I understand, like I mean, after what happened during the lockdown, I don't think we should be able to judge young people when someone comes to buy a condom, because all they're doing is they're trying to prevent themselves from, you know, having unintended pregnancies and STIs. So we should actually upload those young people that, you know, come out and you know, they're trying to access these services. All we should be working on is ensuring that these services are actually available, and you know, young people, we should just be calling out the young people to just come and access them.
Okay.
What have been the pros and cons of you covering these stories?
I mean, most of the times people will call you the sex reporter. Right? Which is okay.
Interesting.
Because it's I mean, it's part of it. It's I mean, you can't talk about sexual reproductive health and rights without talking about sex. But it's not about sex. It's not entirely about sex. When you break it down, because when you look at the SDG 3, which talks about good health and well-being, SRHR is captured in there, so it's a concern, But you know, apart from being called the sex reporter, it's for me, it's just fulfilling, just going out there, you know, living in the minds of young people, understanding their challenges and how they want to be helped, and sometimes doing stories and seeing, you know, change coming through. I think for me the most heartbreaking time was during the lockdown when I visited the West Nile northern region, and you'd find a 13-year-old, 14-year-old carrying a baby, and you know, they don't know, sometimes they don't even know the father of the child. So it's a bit heartbreaking, but I think we're on the right track towards you know, rectifying some of those things.
In your closure, you've related with you know, all sectors, from social to those that actually come out with policies. And what's your recommendation as you journey on in covering these stories?
I think, like most CEOs, I think sometimes we have the policies, but usually we really struggle with implementing these policies. But we should really work on the sexual education and allow young people to get this information early at an early stage and allow them to make independent decisions free of coercion, free of judgment. Yeah, but also we should make services available and accessible. It's one thing for them to be available, it's another thing for them to be accessible. These young people need these services, and sometimes they don't even know where to find them. But the other thing is making information about SRHR available and accessible, and really trying to debunk the fake news that's out there. Yeah.
Right.
Creating a safe environment for...
Olivia Komugisha, many thanks for helping us understand how you personally, and of course working within the aegis of the Nation Media Group and NTV in particular, are reframing the coverage of SRHR issues within the media. Of course, you can follow Olivia Komugisha. She's big on Twitter, and no doubt you can. They
know me as Small Goddess.
Small Goddess.
Oh, yeah.
Interesting there. All right, before the oracle beckons, I'll have to go for a break. There's a lot that's still coming up. Do stay with us.